Hello everyone and welcome to our channel Quaint Cosmos. Have you ever seen a TLD in action? TLD means a thermoluminescent dosimeter. This is a small device used to measure radiation exposure. So whether it is hospital or research lab or space mission or nuclear power plant, everywhere there is a requirement of using such a device known as TLD. Though other devices are also there such as film badges which darken when exposed to radiation. But film badges are not reusable. That is the problem with film badges. Film badges darken when exposed to radiation. But here doctors means in hospitals, whether these are hospitals or research labs or space missions, okay, everywhere actually they prefer TLD, means thermoluminescent dosimeter, because the reasons are of course there. That's why they prefer this thing. And the advantages of this is these are reusable. TLDs are reusable. In short, these are called TLDs, right? So, and you know the requirement of measuring radiation. That is the requirement because we know that radiation is harmful to our body. Since radiation is harmful to our body, so we need to measure them. And accordingly, if we are more exposed to radiation, in that case we can take the proper measurement. Means we can take necessary action according to the exposure to radiation. Anyway, so I was talking about TLD, means thermoluminescent dosimeter. So here what is used actually? Here crystals are there inside that device, and that device are on any part of your body such as a wrist or finger or neck, okay, even on your clothes as badges. Those things can be used because these are very small device, okay, tiny device. So this can be used anywhere on your body, even on your clothes this can be used. Actually what these are crystals are there. Normally lithium fluoride or calcium fluoride crystals are used in TLD devices, okay, and when those devices are exposed to radiation, in that case those incoming radiation excites the electrons of the crystal. So the electrons move from valence band to conduction band, and they are trapped inside the defects. Means they are trapped at the defects. Defects means such as impurities or lattice defects. So they are means here electrons. When incoming radiation, okay, means when the crystal like lithium fluoride or calcium fluoride receives incoming radiation, so the electrons inside those crystals are excited. So they change their state from valence band to conduction band, and therefore they are trapped at the defects like impurities or the lattice defects, and they remain in that state until the crystal is heated again. Until the crystal is heated, they remain trapped, means they remain in metastable state, those electrons. So this way devices work. Those TLD devices work this way. And after a month or after a few months, okay, those devices are used by reading devices. Okay, reading devices are there. They are used separately. So not daily. After a month or after a few months, those devices are used for reading out the data. So the reading devices actually what they do, they supply heat to the dosimeter, and when the dosimeter, means the crystal inside the dosimeter, receives heat, then in that case they emit light. And the electrons move from the conduction band to again valence band. So whenever they are heated, they release light, and that emitted light is proportional to the amount of radiation received by the dosimeter. So just by measuring the emitted light, we can measure the radiation received by the dosimeter. So this way TLDs work. And if very low radiation is present, in that case also this acts well, very well, these TLD devices. Okay, so that means what? That means for precise measurement, for accurate measurement, whatever be the level of radiation, everything can be, in each case, these TLD devices can be used. And that's why this is considered as gold standard in medical field. And these are used by radiologists, X-ray technicians. You know, X-ray in hospitals, X-rays means radiation is there, CT scans means radiation is there. Again, in case of radiation therapies, like cancer is treated by using radiation. So again radiation is there. That means the healthcare professionals like doctors, nurses, then patients are undergoing repeated imaging. That means those patients are exposed to more radiations since they are undergoing repeated imaging depending on the diseases. Okay. Anyway, so patients as well as healthcare professionals, they normally use this device, these TLD devices. Okay. And one more plus point is there, batteries are not needed. They work passively. These devices work passively without batteries. Batteries are not needed. Reusable. Okay. These devices are reusable. So many positive points are there, plus points are there, and that's why these are considered as a gold standard in the medical field. And not only in hospitals, many where these are used, these TLD devices. Okay. Anyway, so this was all about it, today's topic. Today's topic was what? TLDs in action. TLDs means thermoluminescent dosimeter. So just a property, thermoluminescence, that is a property of certain crystals like lithium fluoride and calcium fluoride. And using that property, these devices are made and these devices are used many well. Okay. Anyway, so this was all about today's topic, and if you found this video fascinating, then please like, share and subscribe to our channel. So see you in the next video. See you in the next video, and okay, so this is the end of this video. Thank you for watching this video.